For all of our early risers, this one's for you. We're talking about sweeteners when it comes to your coffee or your tea in the morning in particular. What's safe to use? There have been some recent news about those packaged sweeteners maybe having a negative effect on your DNA and your overall health. So here to talk about our best options and some alternatives is our health insider, Dr. Shad Marvasti. Good morning.
Good morning.
So there has been some recent news about packets like Stevia, Splenda, which I think were alternatives that people thought were the healthier alternatives. So I guess we should start with some of the negative impacts of adding an artificial sweetener.
Yeah, so I think artificial sweeteners, one that's been around probably for the longest is aspartame, which is in a lot of diet products. Over the years, we've found that it can actually potentially be toxic to our gut bacteria, our good bacteria. And there may be even some evidence to suggest some association between aspartame and neurodegenerative diseases like, Parkinson's and things like that. Diet soda, for example, is associated with higher risk for diabetes than regular soda. Well, why is that? It's because it disrupts and fools our bodies in a way that confuses our whole endocrine system and our hormones. So, it's something that you don't want to really mess with. This is all very concerning, I think, because, people think that 0 calories or, not having sugar, which obviously don't want to have too much of, is better than having sugar. And in some cases, you may actually be better off to actually having some real sugar as opposed to one of these other chemically derived sweeteners because they have other lasting negative health effects.
So let's talk about the ones that people thought were healthy, if you will. Stevia, monkfruit as a sweetener has been, kind of rising in popularity lately. So are those safe?
We haven't seen too much in terms of negative from monk fruit, especially because it's less refined than the other ones. And it does come from monk fruit, which is an actual fruit. But it just happens to be the chemical formulation of that sweetener is such that it doesn't raise your blood sugar. Some of the other sugar alcohols like erythrotriol, other things that are with monk fruit, a lot of times, those are ones that are more concerning. So I would say make sure that it's just monk fruit and nothing else. Stevia actually so far has not really been shown to have major negative health effects yet. So that's still one that is, something that I would consider in moderation. Otherwise, outside of these types of sweeteners, I would say everything else has been shown to have potentially, significant health effects that are negative. But then ideally, you want to also try a little bit of raw honey, or if you don't want to have a big impact on your blood sugar, I wouldn't do agave because agave really does spike your blood sugar. But what doesn't is actually raw maple syrup. Maple syrup doesn't raise your blood sugar as much as honey, agave, or any of the sugar-based sweeteners.
And then if you are somebody who is reaching for that cup of coffee, because like you said, moderation is key. But if you're somebody who goes to that cup every single day, then the bottom line, just go ahead and opt for the real stuff, but don't overdo it.
Yeah, I would say opt for the real stuff, but don't overdo it. Less is definitely more. There's a lot of these mixed drinks that just put a ton of sugar in it. Or if you're pumping with flavors like vanilla, other stuff, then it's not just vanilla flavor, it's sugar. But look for alternatives like adding some cinnamon or some nutmeg, considering some of these things which kind of give it a little bit more of that sweetness taste without actually adding sugar to it.
And that's what these conversations are all about. We always want to try and find the healthier, natural alternatives, but we also know realistically what people are dealing with. So we try to guide you on the path for your better option. And that's exactly what you've done today. We appreciate that, Dr. Shad.
Of course, my pleasure. Thank you.